couple weeks ago, Rebecca Traister wrote that those who have been trying to sound the alarm about abortion have been shooed off as silly hysterics. Well, the sky is falling, chickens. Missouri could lose its last clinic. Alabama has passed a near total abortion ban and suggested sentences of up to 99 years for doctors who perform them. And Clarence Thomas is comparing abortion to eugenics. So yeah, I guess I am fucking hysterical. What do we do to protect abortion rights? Lots of things all at once. Protesting, voting, organizing, donating, and educating. Enter Plan C, a group that's working to make abortion pills and information about them accessible to women across the country. To tell us more, we're joined by Amy Merrill, Plan C's digital director. Thanks for coming to the BRIC House today.
Thanks for having us.
And actor and advocate Jess Jacobs. Welcome to 112BK.
Thank you so much. Happy to be here.
So, Amy, we know about Plan B, also known as the morning after pill. What is Plan C?
Sure. So Plan C really started as a campaign to share information. It was started by two women who had been working for decades in the public health space, and also to bring Plan B over the counter. When it was first introduced, it was prescription only, which kind of defeated the purpose of a morning after pill. So that was their first fight, and they accomplished this, now available as widely as Amazon Prime. And from there, they started to look around the space and, especially doing some international work, realized that in the end of the 1990s, this combination of drugs, mifepristone and misoprostol, had been recognized as safe and effective, actually incredibly safe and effective, to provide self-managed abortions. You know, over the years, as this becomes more and more commonplace around the world, it was not so in the U.S. And so the campaign started 4 years ago in order to just start spreading information about what are abortion pills, let's clear up any misinformation about the safety and efficacy, and then start to look at what could be some new inroads, some new channels of access for people in the U.S. who desperately need all of the options available.
So unlike Plan B, Plan C is not a pill. Plan C is a movement. It's a campaign to educate people about abortion options.
That's right. Yeah, we really came up with the name because it was obviously from the idea that Plan A is birth control, Plan B is the morning after pill, and doesn't everyone need a Plan C when those two things fail or are not available?
And how many years has the organization been around?
It started in 2015. Very grassroots, and we started our website in 2016 to share information and allow tools for advocacy. And since then, it has grown exponentially with our digital presence to the tune of anywhere from 30,000 to 50,000 hits on the website per month of people searching for information or wanting to know how to get involved.
And Jess, I don't know how long you've been involved with Plan C, but back in 2015, what was the climate like? Were people sort of like, what's the need for this?
Yeah, I think that the abortion conversation has been complicated for a long time. I'm trying to think back to 2015. There wasn't really talk as far as the communities that I was involved with around access to the pill pack, the misoprostol and mifepristone. Over the counter, it wasn't really something that was dialogued because people weren't concerned to the same degree that abortion was not going to be available by prescription by your doctor. As the climate has changed, I think that we've seen a growing need for access to be deliverable right into a woman's hands rather than her having to go out, sometimes drive 3, 4, 5 hours, 24-hour waiting periods, these kinds of things that are just completely untenable. And don't actually allow for the access that is technically legal, but if it's de facto not available, then our de jure situation doesn't really serve women terribly much.
And I think this sort of harkens back to the piece in The Cut that I mentioned,
yes,
where for years now, abortion activists have been sounding alarm bells, being like, oh, you guys, people are chipping away at our rights. And everyone's been like, hey, like nothing to be concerned about. It's fine. We've got Roe v. Wade. And now all of a sudden, Plan C seems like a really important movement.
Yeah.
So, Amy, I know that you are not a medical professional,
right,
but what can you tell us about this 2-pill pack that you mentioned? What is it? How do you use it? And is it safe?
Sure. So it, as we mentioned, it's the combination of mifepristone and misoprostol, and the process is actually very simple. On our Plan C website, we direct people to other nonprofit organizations who provide instructions on how one would do a self-managed abortion, but it's basically taking one pill, waiting 24 hours, taking the other 4, and then checking your body's condition, and if the abortion was in fact complete, then the person is all set. And if there are indications that it wasn't complete, they can very, very safely take a few more of those final pills. And the stats are that it's 98% effective and extremely safe. The comparable that we often talk about is that technically it's more safe than Viagra. And that's something else that people are getting on the internet and very, very easily and successfully all across this country. And yet it's talked about in a very different way than abortion pills.
Absolutely. Right. And are these hormones? Like, what is actually happening when you take this combo of pills?
Mm-hmm. Sure. So you can speak to it as well. The simplest way of comparing it is that it's effectively a miscarriage.
Yeah. It's a miscarriage induction, essentially. It loosens the walls of the uterine lining and then induces cramps to pass the
And is
tissue.
this type of medical abortion used in other countries?
Extremely frequently. It's endorsed by the WHO as a best-in-class solution, and it's to the tune of millions all around the world.
And often, actually, internationally, it's used more often than surgical abortions because surgery is not something that is widely available, especially in rural communities and developing nations. And in countries where abortion is not legal, often women will use sort of underground ways of getting this medication.
Yep, and our other statistics that we've read are that in Europe, it's 90% of all abortions are with abortion pills. And so it's compared to here in the States, you realize, there's so much that we have to recognize about stigma and access and misinformation about the options available when someone chooses to have an abortion.
Right. I'm reminded of the fight in the 90s, I believe, over RU486, where this was widely available in the rest of the world. It was safe, and the FDA dragged its feet because they weren't sure that it was safe or the efficacy, and it was politically motivated, obviously. And so I think when we look at this, it rings, again, those same alarm bells of political agenda against abortion.
Exactly, and that's really the conversation that Plan C wants to push forward, is to recognize that these decisions that the FDA made and have still kept in place, which are called REMS, Risk Evaluation and Mitigation Strategy. These are rules placed on how this drug is distributed and who can provide, mainly clinics and abortion providers who are on an abortion provider list. And those are not based in any kind of medical statistics or science. Those were purely introduced as this was introduced to the States in the early 2000s as what we see as a political tool.
So say I am a woman who wants to have an abortion, and maybe I live in Missouri or I live in another state where the closest abortion clinic is across state lines. I can't take off work. For whatever reason, I cannot seek a safe surgical abortion. How do I order this 2-pill combo?
Good question. So if you went to the Plan C website, which is plancpills.org, you could see a report card of sites that we have done research on and have tested for the speed that the pill packs are delivered, for the amount of information available. And right now at the very top of that list is aidaccess.org, which is a site that's backed by a doctor in the Netherlands. It's with telemedicine. It's with prescription. It's basically the full-service support system. And the other thing that we also provide in the information on the Plan C website is to ensure that an individual, regardless of whatever state they're in throughout the U.S., can understand any legal risk associated with ordering online.
And what are some of those legal risks, and does it vary state by state?
It does vary state by state. There's different levels of regulation in each state as people more and more are starting to realize because of news headlines. And the thing about all of those regulations is that the lawyers have told us that under the Constitution, our right to bodily autonomy is still protected. And so any of those laws would not
That's crazy that you just had to say that sentence,
I know.
by the way. For now, our right to bodily autonomy is still protected.
Remind everyone, the Constitution is still protecting our right to do what we wish to our own bodies. And so if any of those cases were to go to court, lawyers tell us that those laws would not hold up in a court of law because of those constitutional rights.
Right. And what about cost? So say I'm ordering from a site in the Netherlands, in Ireland, in Canada, wherever. How much can I expect to pay?
Sure, it varies, but we list that on the report card as well, and it's usually around a couple $100s. In a clinic in the U.S., the average cost is closer to $600.
And just why did you decide to get involved in Plan C? I know Amy is the digital director for Plan C. You're an advocate. You're somebody who feels strongly about this issue. Why is that, and why specifically are you involved with Plan C?
Sure. My drive to get involved came from a personal experience. When I was 19, I found myself pregnant and in school here in New York. And it was absolutely not the right time. And the decision for me was a very easy one, actually. And it was the process afterwards that felt slightly more complicated, mostly to do with the stigma. I didn't share it with anybody, including my family. Actually, that's a lie. I shared it with one person. It was the friend who had to pick me up from the clinic. But that was about it. She was the one who told all of my other friends that I was sick. I really was so ashamed. And when I finally, a couple of years later, told my mom, she confided in me that she had also had an abortion, also when she was 19. And I realized that I was not alone and I didn't have to go through the experience by myself. It drove in me a real desire to make this conversation a more open one. And so I started doing a lot of work in birth control access and sexual education. So organizations like the UN Foundation and the Universal Access Project, Peer Health Exchange, some of those folks, and then also got connected to PSI and have been working on a project in Cote d'Ivoire in West Africa around access to contraceptive care, and had been looking for a way to get involved in the abortion conversation in a way that really felt organic and meaningful. And so when I was introduced to Plan C, to Amy, and to Francine, it seemed like such an obvious fit because of how much it was focused on autonomy and kind of to the thing that I mentioned before. It wasn't saying in the event of an emergency, here's some healthcare that's available to you. It really was saying this is about putting power in women's hands. And I think we use the word empowerment a lot. Empowerment sort of implies that we're imbuing somebody without power with power. There's sort of a natural hierarchical structure that's implied there. And I actually feel that what Plan C does is it powers women. Is it allows women to power themselves.
That's right. And just to round it off, again, our goal is really to share all the information so that someone can make the most informed choice possible. And that does include understanding the landscape of abortion access and of any legal risk here in the U.S. And there's a really wonderful partner called If, When, How that is a group of lawyers that is solely dedicated to providing telephone consults to anyone in any state and ensuring that they have all their questions answered. So Plan C is really working to be the hub for all of that entire spectrum of information so that someone can make a safe, informed decision in this time of dramatic change here in the U.S.
I know that we have already seen women going to jail for seeking abortions. Have we seen any women be arrested or prosecuted for mail ordering pills?
Yes, so there is a handful of cases that have happened over the last 20 years. And that's really, our understanding is that that is really because they did not have proper legal support. And again, back to the point that if they had proper legal support in their court case, then they would have been protected under the Constitution. And unfortunately, that was not the case. So there has been a handful of cases, and there have also been, the statistics that we understand right now are that this is happening to the tune of tens of thousands of online orders in the states this year. And that's an estimate because obviously this is something that is not very traceable right now. But again, we just want to help people understand the legal risk in the larger context of how empowering this is and also how strongly we believe that this should be available here in the States.
Amy, Jess, thank you so much for your time.
Thank you for having us.
Thank you.